Hey there, friends. Do you remember Nancy Sinatra, the legendary singer who had us all tapping our feet to "These Boots Are Made for Walking" back in the 60s? At 74, Nancy faced a challenge many of us know too well: knee pain from osteoarthritis. Those iconic steps she took on stage were getting tougher, but with determination, a smart lifestyle, and a successful knee replacement, she kept right on walking. Today, we're diving into Nancy's inspiring journey, how she tackled knee osteoarthritis and came out stronger at 85. You'll learn practical tips on diet, exercise, and medication to keep your knees healthy and stay active no matter your age. So grab a comfy seat and let's discover how to keep moving like Nancy. Stick around to the end for some great tips you can start using today. Nancy's diagnosis and first steps. Picture this. It's 2014 and Nancy Sinatra, at 74, starts noticing something's off. Her knees ache after a walk, feel stiff in the morning, and sometimes make a creaky sound when she moves. Sound familiar? She heads to her doctor, who orders an X-ray and MRI. The verdict? Knee osteoarthritis, a common condition where the cartilage cushioning your knee wears down, causing pain, swelling, and stiffness. It's something 40% of folks over 70 deal with, but only about 15% feel serious symptoms. Nancy's case was advanced stage 3, with significant cartilage loss. But she wasn't about to let this stop her. Nancy got to work with her doctor to manage the pain and slow the disease. First, she revamped her diet. She switched to a Mediterranean-style plan, full of anti-inflammatory foods like salmon, walnuts, and leafy greens. She cut back on sweets and processed snacks to keep her weight in check, easing the strain on her knees. Here's a sample of her daily menu. For breakfast, oatmeal with blueberries and almond milk. For lunch, a salmon salad with spinach, tomatoes, and olive oil. For dinner, grilled chicken, sweet potatoes, and steamed broccoli, and a snack of Greek yogurt with honey. Next, she started physical therapy. Her therapist had her do gentle exercises to strengthen the muscles around her knees, like straight leg raises, sitting in a chair, lifting one leg straight out, holding for 5 seconds, and repeating 10 times per leg. She also walked 15 minutes a day on flat ground with supportive shoes and swam twice a week to keep her joints moving without stress. Nancy used a knee brace to take pressure off her joints and avoided long periods of standing or climbing stairs. For medication, she started with acetaminophen, 500 milligrams twice a day, for mild pain. It's safe for most seniors if you stick to the dose. She also took ibuprofen, 200 milligrams as needed, to ease swelling, but her doctor warned her to use it sparingly to avoid stomach issues. She tried a corticosteroid injection once, which gave her a few weeks of relief, and took glucosamine and chondroitin supplements, though results vary for everyone. These steps helped, but her pain kept creeping back, signaling it was time for a bigger solution. The knee replacement and recovery. By 2015, Nancy's knee pain was too much. Her doctor recommended a total knee replacement, a surgery where damaged cartilage and bone are replaced with a sturdy titanium and plastic joint. It's a big step, but for severe osteoarthritis, it's a game changer. Over 90% of patients report less pain and better movement after recovery. Nancy went for it, and the surgery was a success. Recovery wasn't instant, but Nancy tackled it with grit. For the first 4 weeks, she worked with a physical therapist on gentle exercises like bending and straightening her knee and doing straight leg raises, starting with just 5 minutes twice a day. She used a walker at first, then graduated to a cane. By week 5, she was walking 20 minutes daily and swimming 3 times a week, great for low-impact joint support. After 3 months, she added chair yoga with moves like seated leg stretches to stay flexible. Her diet stayed the same, Mediterranean with extra calcium and vitamin D from foods like Greek yogurt and sardines to keep her bones strong. A sample day: breakfast, oatmeal with walnuts; lunch, grilled salmon with quinoa and kale; dinner, turkey with roasted veggies; and a snack of an orange with a handful of almonds. She kept her weight steady around a BMI of 22 to protect her new knee. For meds, Nancy used acetaminophen for post-surgery pain, sticking to 500 milligrams up to 3 times a day. She phased out ibuprofen, relying on her exercises instead. Her doctor prescribed 800 IU of vitamin D and 1,000 milligrams of calcium daily to support bone health, reducing the risk of fractures. She avoided high-impact moves like squatting or kneeling and wore supportive sneakers, not those famous high-heeled boots. By 6 months post-surgery, Nancy was back to her active life, attending events in Palm Springs and even doing some light dancing. Her new knee let her move without pain, proving that with the right care, you can keep going strong. Her secret? Sticking to her diet, exercises, and a positive mindset that kept her motivated. Lessons from Nancy for seniors. Nancy Sinatra's story is a beacon of hope for anyone facing knee osteoarthritis. At 85, she's still shining, showing us that you can stay active and vibrant even after a serious diagnosis. Let's break down the lessons from her journey to help you protect your knees and live your best life. Lesson 1. Eat for your joints. Nancy's Mediterranean diet wasn't just tasty, it helped fight inflammation. Load up on salmon, mackerel, or sardines for omega-3s, which reduce joint swelling. Add colorful veggies like broccoli and bell peppers for vitamin C to support cartilage. Whole grains like quinoa and nuts like almonds keep inflammation in check. Avoid processed foods, sugary snacks, and red meat, which can worsen inflammation. If Nancy had started this diet in her 50s, she might have delayed her knee issues. Try this. Swap 1 soda a day for green tea, which has antioxidants to fight inflammation. Lesson 2. Move smart, not hard. Exercise is key, but it's got to be gentle. Nancy's straight leg raises and swimming strengthened her knees, supporting muscles without stress. You can try 15-minute walks on flat ground, cycling on a stationary bike, or chair yoga. Simple poses like seated stretches work wonders. Aim for 30 minutes, 5 days a week, but always warm up first. If Nancy had done low-impact exercises earlier, her knees might have stayed stronger longer. Avoid running or jumping and always check with your doctor before starting. Lesson 3. Be smart with meds. Nancy used acetaminophen for pain and ibuprofen sparingly for swelling, but her doctor kept a close eye to avoid side effects like stomach trouble. Corticosteroid injections gave her temporary relief, but they're not a long-term fix. Glucosamine supplements might help some folks, but results vary. If you're on meds, don't skip your doctor's advice. NSAIDs can be risky for seniors if overused. Nancy might have leaned on natural remedies like acupuncture if she'd known earlier, which studies show can ease pain for some. Lesson 4. Keep your spirits high. Nancy's positive attitude was her superpower. She stayed active in her community, hosting events in Palm Springs and connecting with fans. A happy mind helps you stick to healthy habits. Try listening to music, maybe Nancy's hits, or joining a local senior group to stay engaged. Stress can worsen inflammation, so take 10 minutes a day to relax, maybe with deep breathing or a short meditation. Lesson 5. Prevention is power. If Nancy had known the impact of high heels or repetitive stress in her younger years, she might have slowed her knee damage. Start early. Maintain a healthy weight. Every pound you lose takes 4 pounds of pressure off your knees. Wear supportive shoes, avoid overusing stairs, and get your knees checked by age 50. Nancy's story shows it's never too late, but starting sooner is even better. Natural ways to protect your knees. If Nancy had known these natural tricks earlier, she might have kept her knees healthier longer. Here are some simple, natural ways you can protect your joints starting today. First, try heat or cold therapy. A warm compress in the morning can loosen stiff knees. 15 minutes does the trick. If your knee's swollen, use a cold pack for 15 minutes every couple of hours to reduce inflammation. Next, consider natural supplements. Turmeric, with its anti-inflammatory curcumin, can help. Try 500 milligrams daily or add it to soup's Nipod Gone system. Soups. You can also sip turmeric tea for a tasty option. Fish oil supplements, about 1,000 milligrams of omega-3s daily, may ease joint pain. Always check with your doctor first. Acupuncture is another option. Some studies show it reduces knee pain for many folks. Gentle massages can also improve circulation and ease discomfort. Choose the right shoes. Ditch high heels like Nancy's famous boots and go for supportive sneakers with cushioned soles to absorb shock. Finally, keep your weight in check. Losing just 1 pound takes 4 pounds of pressure off your knees, making a big difference. These natural steps, combined with Nancy's approach, can help you stay mobile and pain-free. Nancy Sinatra's journey proves that knee osteoarthritis doesn't have to stop you. At 85, she's living proof that a healthy diet, smart exercise, careful medication, and a positive outlook can keep you moving. Start today. Add some salmon to your plate, try a 15-minute walk, or talk to your doctor about safe pain relief. Prevention is key. Keep your weight down, wear good shoes, and stay active to protect those knees. If Nancy's story inspired you, give this video a thumbs up and subscribe for more health tips tailored for seniors. We'd love to hear from you. Share your experiences with knee pain or any questions in the comments below. Got a loved one dealing with osteoarthritis? Share this video with them. Check out our playlist on senior-friendly exercises for more ways to stay strong. Keep walking, friends, and we'll see you in the next video.